Okay, perfect. All right, so I will jump in with this presentation. So good evening, everyone. I'm William Nance with the Department of Planning and Development. I am joined by Anna Ricklin from the Health Department and Zach Larnard from Neighborhood and Community Services. Next slide, please. Thank you. So this is a brief agenda for tonight's meeting. So in December 2022, the board authorized a complete review and update of the policy plan with three major goals: to review, update, and streamline existing policy plan elements, add new policies as needed to address topics such as community health and equity, and ensure the policy plan is in alignment with the strategic plan and other recently adopted or endorsed board plans. Next slide, please. Thank you. So before we dive in, here's a brief overview on the difference between the comprehensive plan and the county's regulatory documents to help frame the work of this amendment. The comprehensive plan is a guide that sets the land use vision for the county and is implemented through the development review process of zoning applications. The policy plan includes goals, objectives, and policies. Goals provide the general direction of the plan. Objectives include statements to help achieve those goals. And finally, the policies include specific approaches for pursuing an objective. The policy plan applies countywide. Therefore, it's important to ensure the policies developed are general and flexible enough to apply across the county, but also targeted enough to address the topic we are working to improve. The area plan volumes of the comprehensive plan provide specific guidance and recommendations pertaining to development within the areas of the county to ensure that development is addressing area and site-specific considerations. The zoning ordinance is a regulatory document that applies to all structures and is intended to promote the health, safety, and general welfare of the public and to implement the comprehensive plan. And finally, the PFM provides the specific engineering guidelines for development and construction. Next slide, please. Thank you. So we are currently in the focused topic outreach phase of the project, where staff is preparing research and information with the goal of starting to draft policies in the fall based on board-adopted documents, outreach input received, and best practices. This policy development work will continue into 2025 with the goal of publishing a community feedback report and draft policies in the first part of the year. The community feedback report will include the feedback received and how it was implemented. And with that, I believe that concludes my presentation, and I'll turn it over to Anna Ricklin to discuss community health.
Thanks, William. I am going to talk about the proposed content or framework for the content of community health in our policy plan. So first, a little bit of information about the connection between health and place. You might have heard the idea that your zip code is more important for your health than your genetic code. And this is because our health is shaped over our lifetime of, as it says on this slide, living in homes, which are in a place, using the transportation options available to us, accessing the services available to us, and making choices based on what resources are nearby. And of course, health status, which is the outcome of our lifetime of conditions and choices that we're living in, is one of the most tangible ways to measure equity among different racial and ethnic groups living in the same place. So place impacts your health, and health is a very important component of equity in our community. A few pieces of data about health in our community as it relates to place. Not all health behaviors or health factors relate to place, but there's a lot of them that do. And one of them is physical activity. Recently, the health department completed a community health assessment for the whole county. And we found that in 26 neighborhoods, at least 1 in 5 adults say they get no physical activity outside of work. There's 5 neighborhoods that are at the top of that list that are shown there on the bottom left. And there are 26, those 26 neighborhoods are mapped. We also see that that not very many people are biking or walking to work, that 1 in 50 people are doing that. And of course, we don't have data on how people are getting to other places, but we do know that we are able to at least have some information. At the same time, people who are going to work are traveling more than half an hour. At least about half people are doing that. So we also know that when you're traveling more than half an hour, you are sitting, you're not moving, you're not getting physical activity, and it's also less time with your family. Just a moment, as my family has invaded. Sorry about that. Um, and for people who are biking and walking, it's a very dangerous environment. We see an average of 172 traffic crashes involving pedestrians every year. So just to kind of get a picture of what's happening in the different factors related to physical activity. When it comes to nutrition and healthy eating, we also see some patterns by geography that, again, some of those same areas, not all the same areas, but some of the same areas where we saw low physical activity. We also see high food insecurity. The map is there, and the list of the top neighborhoods is there for the places where people are the most food insecure, meaning they're not able to afford food on a regular basis. On the flip side, we also have a problem with overweight and obesity in the county, which we're not alone in the country with having both food insecurity and having overweight and obesity. But we do believe that these are problems that we can deal with, not just through public health programming, but also through some of our place-based policies. Ultimately, all these things roll up into your life expectancy, how long you get to live. This is just a handful of census tracts across the county where we see pretty significant differences in life expectancy, which is kind of the ultimate health measure. It's a 13-year age gap between people who live the shortest in Fairfax County and the people who live the longest number of years. Again, we're not alone in having a significant age gap between different parts of our geographic outline of our jurisdiction, but 13 years is a large number. We should not be seeing such a significant gap in a county with so many resources, with one school system across our county, with a lot of resources, again, available to people who are struggling and to support people living healthy lives. So what are the pathways for how these factors connect? It's just a couple of factors that I wanted to go over with you tonight, outlining the potential health impacts of our built environment. So one of them is around transportation. And we can think of it as in two categories, both the direct impacts of a factor and the longer term or indirect impacts of a factor. So with transportation, we see direct impacts on respiratory health. Of course, if you're involved in a crash, whether you're in the vehicle or outside the vehicle, that's pretty impactful on your health. And air quality also can impact our cardiovascular health. Over the longer term, though, the impact of noise from transportation can impact our mental health. The impact of poor air quality, living on busy roads with both noise and poor air quality can impact our health. Of course, busy roads also separate communities, so that can impact our community cohesion, our social connections, and of course, the options that are available to us via the transportation network limit or give us increased access to an array of things that support our health, like education, employment, grocery or healthcare services. So when we're thinking about what we can include in the plan that will help address some of these direct and both indirect impacts, we want to think about pedestrian infrastructure and connections to transportation choices, what kinds of land uses we're putting near major roads, and of course, road design itself, and many other factors. This is just a handful of examples. Then we have the environment, also a list of direct impacts. The quality of the environment affects our water quality, affects our air quality, which can lead to respiratory illness, also connected to cardiovascular health. The Quality of the environment, the cleanliness of the environment can directly cause stress. And of course, heat, as we're seeing an increased number of very hot days during the year, during the summer, can directly impact our health as well. Can also impact heat, especially in the bottom right there, can also cause significant chronic stress over time. And so we're very concerned about that, of course, with climate change. That can affect our mental health. It can particularly affect communities with lower incomes who might not be able to run air conditioning as often. A lot of these things can add up. Um, and the quality of the environment can affect our community and social cohesion. A few things to think about with the environment are the distribution of impervious surfaces. So where are we seeing the heat island effect happening and where are we not seeing it happen as much? How can we include more trees and green space in our planning? And of course, thinking about green building. This slide is a list of the sources of all of that data that I just went over with you. So thinking about new directions, and I think, Zach, you were going to speak to some of these other plans.
Yes, thank you, Anna. Thank you, William. Thanks for everyone joining us tonight. So, as part of this process of looking at updating the policy plan, we looked at what some other neighboring jurisdictions have done, especially paying attention to health and seeing where healthy communities and things like that have been addressed in other neighboring jurisdictions and other plans. So, we do have the city of Fairfax, which has updated their comprehensive plan in 2022, just 2 years ago, and they did touch on environment and sustainability. And one of their goals is to support physical activity and healthy lifestyles. And another one is access to healthy and regionally grown foods. And each one of these things, as Anna mentioned, all these things are interconnected, and a lot of these things impact each other. So if we're able to have physical activity and healthy lifestyles, it's also great to have healthy food to go with that, and local food. Another local jurisdiction nearby to us is Montgomery County, which recently passed their Thrive Montgomery 2050 plan. And this was an update to the countywide comprehensive plan in Montgomery County. And this is also looking at providing equitable access to jobs, housing, transportation, parks, public spaces, and it also a design guide of the built environment to strengthen social and physical health of residents. And those are all things that we think are important things that can be included in this update of the policy plan as we look at health and what impacts health. So those are some of the neighboring jurisdictions that have done some health plans. And it's important to look at those as we also look at what we have currently in our plan. There is an existing human services element of the policy plan. It is rather outdated. It was written in 1990, and we know a lot of things have changed since then. Most of the program and service focus guidance comes from the Principles of Human Service, which is a document that was developed by the Human Services Council. That's a group of residents that still exists today that advises the human services departments. But they came up with that list, Principles of Human Service, in 1989. And there's a lot of text in that document that also focuses on facilities. And again, these are things that have changed over time, best practices, how to use the facilities, different treatment styles, and different ways to deliver aid and services. That's all changed as well. So some of the things that we've looked at is moving some of those facility pieces into the public facilities piece of the plan, and then also looking at upgrading and updating those human services, principles of human services, to a more broad community health focus. And as I said, there's a lot has changed since 1990. A lot of things are outdated, and the also important documents of the One Fairfax plan and the countywide strategic plan were not in place in 1990, and those are now new, well, relatively new, but important guiding documents in the county right now. And speaking of the comprehensive plan and the strategic plan, there are several different topic areas and goals in the strategic plan, many of which touch on health and healthy communities. But two of them that we really wanted to point out here were healthy communities, looking at integrating considerations of health, well-being, and equity into the development, implementation, and evaluation of land use, transportation, housing policies and ordinances. And another one is in the housing and neighborhood livability section, linking the county's public health and equity agenda to a public space agenda by updating the comprehensive plan to create healthier environments where access to basic needs, transit, affordable housing, and healthy food is available. So these are all the goals that are, guiding us as we begin this process of updating the policy plan. And then Anna can talk about a few of the buckets and topic areas that we're looking at considering to include in the updated comprehensive plan document, policy plan document. Thank you.
So looking at some of those other examples from other places, and even more than what we have time to really talk about today, because the point of this meeting is really to hear from you, and thinking about some of the gaps in our current plan, some of the things that Zach was talking about. We have some coverage of public facilities, we have some coverage of human services, but we don't really have anything on active living. We don't really have anything specifically about access to healthcare. Certainly hardly anything in our comprehensive plan, at least on food systems or social connection, social cohesion. And then finally, we also want to cover green infrastructure and healthy buildings. A lot of this content may be complemented with information and direction in other sections of the plan. So you see in the active living photo, we have a person on a bike and next to a sidewalk. Of course, the community health chapter or the healthy communities chapter, whatever we end up calling it, will not necessarily be giving technical advice on how to organize or build bike lanes. That's really a transportation topic, but we do want to cover that those facilities are really important for a healthy community. Similarly, we're not going to give specific guidance on healthy buildings or green infrastructure, as a lot of that is covered in the environment section of the plan, but we do want to have explain the clear connection between health and those components of our built environment, like green infrastructure, and potentially give an outline for how we can prioritize the implementation of some of those things. So these are our proposed 5 buckets. We're interested in what you think of these, and I believe this is our last slide as we move into questions and discussion, and want to hear from you with some of your ideas. So I'm going to stop sharing actually, so we can see each other. And I can always call up the presentation again if you do want to see a slide again.
Anna, there was a question in the chat about who's in the health department, and we said you are a member of the health department. If maybe you want to elaborate a little bit on what your role is in the health department.
Oh, sure. Yeah, I realized we didn't introduce each other. Well, William did. But I'm Anna Ricklin. I am the Health and All Policies Manager with the Health Department for Fairfax County. And my role is to work collaboratively with other agencies across the county to integrate health considerations into their policy work and into projects and plans. So I work a lot with transportation, planning, housing, NCS, other agencies where that's happening. Zach?
Yes, great. Thank you. My name is Zach Larnard. Thank you, William, for the early introduction. I am the Planning and Capital Facilities Manager for Health and Human Services, which is a collection of several agencies, including the Health Department and Neighborhood and Community Services, Department of Family Services, and the Community Services Board. And so I work on the capital improvement plan and capital projects to make sure all those agencies have the facilities they need to deliver the services for Fairfax County. And I will go to, I see a hand raised, so take it away. I'll go with JW since your hand was up first.
I think you're muted, JW. Are we having an issue with Teams? It looks like Elaine might be talking, but we can't hear her.
I'm not talking. I'm still on mute.
Oh, okay. Oh, I guess you're outlined because you're have your hand raised. It looks like JW is having an issue. Maybe you could have your question, Elaine, while we're waiting.
Yeah, I have several things I'd like to discuss, but let's just start with making sure I understand, because I didn't hear any of you particularly from the planning. Is that, William, are you the planning department?
Yes, I'm with the planning division, so we work with the comprehensive plan. Yes.
What I want to understand is, right now the comprehensive policy plan has these sections, right? It says environment, whatever, blah blah blah. There's a whole bunch of them, and I guess we're talking about actually adding a new one of those subsections that says health, or is this going to somehow just be integrated into each of the other ones that are there?
That's something that we're still working through, and part of why we're here tonight. We're trying to figure out what works best for our plan, and that may be having a section calling to it in other sections, or different things that we're still working through. So we're not at that stage yet.
Okay, and why I ask is because we're struggling right now with, well, I'm struggling right now. We're trying to understand how, when somebody sits down, for instance, in the land use area, in the environmental subsection of it, to take a look at this application, maybe it's a comprehensive plan change, or maybe it's in the zoning area, and they evaluate this proposal against whatever it is they evaluate against, those criteria. And so my understanding that I got as of the end of last week is they go to this comprehensive policy plan and they just look at the bullets that are there. And I think there's some stuff really missing right now in this environmental area. So that's why I'm trying to figure out what's going to be called out in particular.
Yes.
So with
yeah.
that said, I went to a I'll just call it a seminar. I don't know what the right word is, but Supervisor Walkinshaw had on air emissions from cars as part of a climate change discussion. And it brings up a couple of points, which is, as we are moving now in the county, especially in these like TSA areas and CBC areas, to put really high density multifamily housing in, I'm not sure that the aspects for and health, this is where I've been going to all of these plan forwards trying to figure out where it fits in, and it sort of sounds like it fit in here, but I don't think it fits in any of those 5 buckets you just had, is really looking at, like the air quality. For instance, the more cars and maybe commuter not gas station, but commuter stations where there's all these buses coming in and out and cars all day, there may be a density of contamination there that we have no regulations about, and we have no nothing on the books, and we don't have any clean numbers. We can just put, oh, this number is not good, but we need to really look at the quality of life for those people that are getting put into areas. And I know there's a balance for Richmond Highway, that bus route that's going in. Part of what they need is all the density of housing along it to use it, right? But now we're putting 7,000 units along this corridor of potential air problems. I know we're trying to go electric, but it's going to be a long time before it's all electric. And so we should be looking at that and maybe setbacks. And another one that's come up is about moving into these commercial areas with housing, where they're proposing to put units right next to gas stations. And you brought up Montgomery County earlier as an example of a place that has, some regulations or planning things you're looking at. My understanding, they've put a setback in place now that's like 500 feet from a gas station for residential. And I think we have a real gap here in terms of really looking at where we're putting this housing. And I don't know, there could be maybe dry cleaners, there could be print shops. I don't know what other kind of people maybe have things coming out, but I think we really need to be looking at that. And I don't know exactly where it fits.
Yes, that's a great point you bring up, and I do think that's something we're working as a team. We have different topic leads for the different topics, and we're working together to discuss that. I think you also brought that up at the environment meeting, and that was relayed to us. But I think that's definitely something that we're working through and researching, and all things that are going to be added into this potential new element or whatever form it takes.
Yeah, I feel like we're at a place where the regulations haven't caught up with the science, because there's nothing on the books that says you can't build something here, or that, and if the gas station, for instance, is operating in the state regulations of however much they're supposed to capture, you capture it, it's all fine. But, does it really make sense to be putting people, and in some cases, we may be putting people that have health problems in there that would be more sensitive. So I just really think we need to take a look at this and how to regulate it. I don't know. I know that I listened to a planning meeting from a few years ago where they said the guy who was putting this project where they want to put a gas station in right next to a bunch of mobile homes said it's 99% of the vapors are captured. And I don't know if that's true or not. All I know is when you're across the street and a tanker truck is filling at that gas station, you can smell it.
Yeah, I think and thank you for that. I think the most important element actually is what is some part of what you just cited at the end, which is the accumulation of burden in particular areas. So the having a gas station next to a high-rise luxury apartment isn't the best, but it might not be as impactful on a community that is already experiencing a number of other burdens. And so one of the things that I've been thinking about and talking actually with the partners who are working on how we're going to integrate a much more of a specific and direct focus on equity into the comprehensive policy plan is about how we can have a process for evaluating impacts. So it wouldn't necessarily be, because the policy plan is also supposed to be fairly flexible. We're supposed to be able to consider, there's a number of things that are principles, I guess you could say. We have our goals, but we don't have that many hard and fast rules in the policy plan. And so, because it is supposed to be guidance, it's not as legal as the zoning code. But one of the things we're thinking about is how can we evaluate what are some tools that we can include in the plan to evaluate how impactful something will be on some of our health principles, which one of them is good air quality. Another is we already have the noise ordinance, and we have a lot of consideration of noise impacts already as we're going through the design review, application review. But noise, air quality, of course, the environment folks are always looking at runoff and potential impacts for our streams and waterways and impacts of stormwater. So what can we do for health? What are some tools? So we're still in that process. So it's helpful for you to cite some of the things that you're concerned about. I know that we've also been talking to DEQ when it comes to the gas station issue for different places around the county. And they're focused on equity as well. So I think, yeah, we still have a lot of work to do. We don't have answers yet for all of these things. So I'm sorry if it sounds like we're just working on it, but that is actually the stage we're at, and your opinions are helpful.
Yeah, and I just thought I didn't mention parks. Parks would be another potential of, do you want to put a park right next to some sort of business that might be generating fumes? Because that's another thing, is you bring these high density housings in, they need to have some recreational land associated with them, and they're trying to work that in. So that's another aspect of how it looks.
Yeah, I mean, with any development, we're weighing the pros and cons of all of the different considerations that we have. So we have such a housing crisis, we need more housing. What are the potential environmental impacts? What are the potential health impacts of current and future residents? All of those things. we need better policies to be able to make those considerations, apples to apples.
Yeah, and noise is another good example when we're going through some of the data center issues in recent past. That while there may be a decibel criteria that if you can't exceed, there's a real difference between living in a neighborhood where something's very quiet and now there's a constant hum of noise, even if it falls below that decibel that they say is going to hurt your ears or whatever. So it is really a quality of life, and comes kind of into this area, I think, that whole, when you're talking about mental health and things like that, that all goes into it too. I see Larry made himself visible. Do you have some comments?
So I was going to offer a couple comments. Anna, you asked if the 5 categories that you had were logical, whatever. I think they are. I like them. Uh, we also were talking a little bit about what's going to be in the health section. Is it going to be integrated with everything else? Uh, I personally think that it's a good idea that you have items that are maybe separate. Uh, and the reason is because you were the advocates specifically for health, although there's going to be, I think, significant overlap, at least with environment, because I think there's a number of different things that come in there. Noise comes in there, air quality comes in, water quality comes in, and a whole bunch of other things. And what I'm most interested is most interested in seeing the mapping between um, what's in the current plan, what might be changed, and where we go from there, because I think that's going to be the real meat of this exercise, because that's going to make the real difference. But I do want to thank you because I greatly appreciate the thoughtfulness of your comments and your analysis. I find every one of these meetings to be different, and I feel like I learn something new every time.
Thank you, Larry. I see JW is back. Are you able to talk now?
Well, feel free to put your questions in the chat also if you're having problems with the microphone.
Microphone. Is this working now? Hooray! That was frustrating. I hate Microsoft Teams. I was curious about the Montgomery County, the Thrive that you're, I don't want to say mimicking, but what was that one of the ones where you said that the cardio health, I'm sorry, the noise and air quality affects like cardiovascular health? Oh no, wait, I'm sorry. It was noise affects mental health and air quality affects our cardio health. Is that correct?
I don't know if those were either of the examples that we shared today.
I was writing things down and I thought I heard that air quality can affect our cardiovascular health.
Oh, I definitely said that, not as one of Montgomery. I was talking about that in relation to transportation when I had a table up.
Okay. And
So your
where
question
does
is
that
how
come
does
from?
air
Oh, I'm
quality
sorry.
affect? Is your question about how air quality affects cardiovascular health?
Well, no, my question was more your sources. And I think you had a slide that you went through for a second that had maybe some sources listed
Yes.
about that kind of information.
Yes, and I don't necessarily have any of the papers that have done the research on air quality and cardiovascular health actually cited there, but there has been extensive research on how the very, very tiny PM2.5 particulate matter can actually enter our bloodstream through the lungs. So it can affect cardiovascular health pretty significantly if you're exposed
Okay, so
over
the
time.
fine, so sorry, I'm not trying to speak over you. So the
No,
fine
no.
particulate matter,
Yeah.
Where is that mainly? What is the source of that? In
From
Fairfax
car
County, like
exhaust.
what would be the source? Okay, so car
exhaust.
exhaust. and what else?
Mainly car exhaust. I mean, it also comes from the tires of cars, any of the bits that are coming off of cars, whether it be the pieces of tires that are constantly breaking apart that, it doesn't matter if it's a gas-powered car or an electric car, those all have tires that are disintegrating all the time. And then, of course, the particulate matter from the
Could you
tailpipe
talk
as
about
well.
how to properly share your screen in Microsoft
Gosh,
Teams?
hold on a second.
That-
Larry?
So one of the first jobs that I had when I worked for EPA was working on the particulate matter standard. So I actually worked on the creation of the particulate matter standard. And if you're interested in detailed information about the health effects, the basis, we had numerous meetings with the EPA Science Advisory Board. That's actually a group called CASAC, Clean Air Scientific Advisory uh, Committee. And but there's lots and lots of documents. So if people are interested in looking at that, they should go to the EPA website, look up the basis for the particulate matter standards, and you'll find a very rich background there. You'll also have reports from the National Research Council, which have looked at these issues as well. So I just thought I would share that because I think that it just backs up what you already said, Anna.
Thank you. That's actually very interesting. I guess my question, and I'm so sorry, like I said, hate Microsoft Teams. My husband's sitting next to me on a different laptop, trying to figure out what's wrong with mine. I was sort of trying to get to, like, so we know this, and I was thinking about that slide where you had the life expectancy. And did you say it was a 13-year difference? Is that right?
Yeah, I can share the presentation again,
Well,
so that we
I was wondering if that breaks down by zip code, or how does that break down?
So that slide, that was information that's available on the Live Healthy Fairfax dashboard. It's publicly available data. I mean, you could actually go to the census and find that data as well, but it's digested for you in a local format on the Live Healthy Fairfax dashboard, and it is actually by census tract, so it's on an even more granular level than zip code.
Okay. And so I guess we don't know what any of those things are associated with, like the fact that there's a 13-year difference. Is there something about those particular areas that I missed part of this presentation, obviously. So,
well, I didn't go into depth about it. We actually do go into depth about the life expectancy gap in, well, several reports actually cover that for Fairfax County. There's the uneven opportunity landscape, which was published by the Northern Virginia Health Foundation, who's kind of were the first folks to really look at that. And then we also have our most recently published community health assessment that was actually a Fairfax County report. So those are the most up-to-date numbers from that community health assessment, which was looking at a number of health outcomes and contributing factors to our health. So that's
okay.
the slides that where I cited the physical activity and the nutrition are part of a much longer presentation, actually, of many more data points on our current health in Fairfax.
Okay. So I guess I'm also trying to figure out what happens with this information now. Like, how does this actually get shared with people who, for example, make decisions on land use?
Well, that's us right now.
Okay.
I mean, that's us right now. So we're taking this different data, and please, Zach or William, jump in. We're taking this different data. We're sharing it with the community. When Elaine, for example, was talking about the thing that's really standing out to her is this air quality issue and habitation near potential pollutants, sources of pollution. That's lifting up that issue for us to like maybe look into further. We also are talking with other stakeholders like the Fairfax Food Council, for example, who has some of this data and is helping us, will be helping us. They're not currently fully engaged, but will be helping us in developing some of the guidance for the food system section. So it's really novel, actually. I mean, for your asking, like, how are we taking this data and turning it into land use guidance? Like, that's kind of the puzzle we're figuring out right now.
Okay, so just a specific example, which is something that's odd to me. Montgomery County. So you mentioned Montgomery County. They, I happen to know, have a 500-foot setback for gas stations to a residence or another like sensitive use, like a daycare or a school or that kind of thing. There is no setback in Fairfax County. Why is that?
Yeah, that's not a question I don't think that we could answer in this group. I think that would be something that would come more from the zoning ordinance, not as much as at a policy plan level. Um, but that's definitely something that, like we said earlier, we're taking into consideration. I think Elaine mentioned that. Maybe I'm mixing it up, but someone also mentioned that. But that's also like we can look at it from the standpoint of the policy plan, but I think that would be something that would be more readily enforced and more in, like Anna said earlier, more legal in the zoning ordinance.
Right, I understand that. I mean, the zoning ordinance is law, whereas the comprehensive plan is just guidance.
Yes, recommended guidance.
But
Yes.
yeah, so that's why I was trying to figure out how is this information being transmitted? Because, for example, the gas station setback, it sounds like we all know that the air quality near a gas station is probably terrible, right? And so you would think that there would be a setback, and there isn't. And so how is that going to happen? Because as of right now, you could have a gas station literally move in next to a house. And it's been done, actually. Elaine, where is it? Route 1? Where's the one that
It's
was it
right behind
2019 or something?
yeah, in 2019, the back lot of the Costco over on Highway 1 put in a gas station, and it is that property has a line of mobile homes abutting it, and just across the street a bunch of townhomes. And there's no rule that says we can't do this, so we'll do it.
So
And
that's
I'm
one
not-
of the things that we were discussing, I think, when you were off the call, was talking about developing a process for evaluating different factors and the uneven burden, the unfair burdens that certain communities experience in the county, and how we can, right now, there is not a process for evaluating the accumulation of burden in certain communities. And so we've been working with the folks who are working on the equity chapter to kind of figure out what would the tools be in the comprehensive plan process to evaluate when projects come in. I think there's a couple of challenges. One is that our comprehensive plan is implemented in a piecemeal way. That's kind of the process of how we do planning in the county. And so not often are we looking at spaces in a very holistic way. So right now there's a study in Centerville, for example, looking at the whole Centerville area. There was a study like 5 years ago in Merrifield looking at the Inova development, but also some of the adjacent communities around that. And so when those processes are occurring, we're able to do a more holistic look at some of these things. But in the way that we're doing planning now, we don't have the right tools. So we are looking at what kinds of tools can we include in the plan without being overly prescriptive that will allow us to evaluate, like I said, the accumulated burden. So having a gas station next to certain communities might not be a problem, especially if there's not like 17 of them or 5 of them. But having a gas station be even larger than it already is next to a community that's already experiencing a lot of burden would be a challenge. And I'm sorry, William, I think you were going to say something.
No, I think you captured it perfectly, and I'm not sure of the specifics of the example that you all were referencing, but you captured it perfectly.
Okay, well, I'll give you some specifics because I missed the equity. I don't know if there's another equity plan forward session scheduled, but So in the Franconia district, there are currently 2 land use cases where a gas station is very close. So one of them is near Springfield, and it would be a private developer. And I don't actually know how close. It's a multi-building. There would be a maximum of like 732 apartments. And I know that there was already concern at the planning commission level because the noise and the traffic and goodness knows what else, because it's practically right next to the interchange where you get on the interstate, basically. So that's one. But the other one that has been very interesting to me is that, are you guys familiar with the current Franconia Government Center?
Yes.
Okay, great. So the new government center is being built. And the question was, well, what should we do with this old property? And I'm sure you're aware that the Board of Supervisors is in the process of taking what they call, I forget what they termed it, like basically excess property or something, and turning it over to the Housing Authority for the purpose of building affordable housing. And what sort of boggles my mind with the Franconia Government Center is that there are literally 5 gas stations within 550 feet. One is literally next to the property. The other 2 are across the street. There's one on the same block, and then there's one that, like I said, the farthest away is 550 feet. And so it was funny because I was walking out of a meeting there a couple weeks ago, and I all of a sudden was like, what in the world? There was this awful smell. And I was like, is that gas? Like, what in the world? And I looked over, the gas station next door wasn't the problem. There was actually a tanker across the street filling up the gas tank at I guess it was the Franconia Amerigo, the one that's like closest to the property. And I was sitting there thinking to myself, okay, I've heard some of the equity presentations in other contexts talking about how, we want people to have environmentally safe housing, and who are the people who have been traditionally more likely to have environmentally unsafe housing. And for the most part, that was people of color, people who are of lower incomes. And so I guess this is just all along sort of boggled my mind that we have a plan to put in 120 affordable apartments next to a gas station, across from 2 others, on the same block as a 4th, and like I said, 550 feet from a 5th. And so I guess I've been trying to figure out, where does all this go? I think we can all say air quality affects our health in general, the fine particulate matter, whatever it is. And yet I don't see anything being done with that information.
I think this is something, that we're taking into account. The environment team already filled us in on the concerns about gas station near residential. That's definitely something that we'll be working with and looking into throughout this process in our research. But any specific setbacks that would be handled by the zoning administration or zoning evaluation division. And we've made sure to compile all the concerns and everything through these meetings, and we'll be sending that to them, and we can collaborate with them and move forward with that.
I think another thing I think these are all good points that you're making, and I think that as Anna said, we're trying to develop a better process to analyze these things, and I think this is a as the county continues to grow and as we continue to build, these are some of the things that we're going to start seeing in the future. Is how do we balance these two needs? We have a need for affordable housing, and we also have a need for gas, because we are still largely a car dependent county, and so how do we balance those needs? And I think this is a thing that we're going to continue to struggle with in the future. And part of it is listening to these concerns now and trying to figure out how we can best address these things for the county moving forward.
Can I ask, Larry Zaragoza, are you a physician? You still
No,
there?
I am not a physician. I'm a biologist. I was a biologist working in the Office of Air Quality Planning and Standards for EPA. Uh,
Ah,
but I did work with a lot of physicians and other health scientists.
okay. Um, yeah, I it was the Franconia Government Center that got me interested in all this, but it's come up in other contexts, like I said, with this situation in Springfield with a private developer, because the Franconia Government Center is obviously publicly, it's taxpayer-owned property. And so, we certainly, it's really a county decision. With the private developer, a private developer gets to build whatever they want on their property so long as, they can get the necessary approvals. And people could buy a house next to a gas station, right? But I guess I'm thinking more about the equity aspect here. If we have an affordable housing crisis in Fairfax County, and allegedly we do, the county has surveys and things that they cite and say that we have an affordable housing crisis, and I can understand that. However, are we so desperate that we're building where we know, because you guys are basically saying that the air quality is going to affect people's health, right? Is that even a question? Like, can you say, like, okay, next to a gas station, yeah, that's probably not healthy. Is
So
that a fair statement?
those kinds of evaluations are really, really tough to conduct. If you look at the compounds you're going to see in gasoline, things like benzene. Benzene is a known human carcinogen. But if you're going to conduct an analysis, you're going to need to look at the levels, because the mere presence of some level of benzene is going to occur by many, many, many different vehicles. And so there comes a point at which it's not a significant threat uh, that you would worry about. Then there would be other sources that really are a threat. Uh, but the at least at least I haven't seen information that says that that they're posing an unacceptable risk to populations that live nearby. And that's really the question to ask. But the other thing is, I haven't looked at the literature on this uh, specifically. So I think that is a question someone needs to ask. But I'm not aware of any evaluation that would say that. You can smell it. And I do know that if you're pumping gas, you inhale it, and you inhale so much that you will off gas it in your breath. And that goes on for hours. Um, but the establishment of an adverse health effect from pumping gas or living close to a gas station, I haven't seen data on that, but I also have not looked.
I'd be happy to send you some studies if you want to give me your email address.
Okay.
Yeah, I just put my email in, Larry. If you want to send me a query, if you don't want to have your email out there, I can send you some references. But there's
I
also
guess
the issue,
oh,
as he just said, is also just about smell as well. I mean, who wants to live where when you open your windows, you smell gas fumes all the time? So it's more than, even if you were to not say the health risk was there, it's still not a desirable place to build. And I don't want to lose sight of the fact that we're focused on gas stations, and I think this is really important because there's known carcinogens in it, but I don't want it to be exclusively focused on that, because I just don't even know what other businesses are out there that we might be building next to that could have similar issues of health risks and just even smell nuisance. Maybe you need a smell nuisance piece.
Well, I think one thing that's good news is I do think that the county is trying to pay attention to these and other issues, and to the extent that they identify anything that is a problem, they do pursue it. I can tell you that I know people in the health department, they have pursued issues like lead, trying to make sure that lead is safe. Uh, and I will tell you that they're putting a lot of focus right now on PFAS. PFAS is an emerging chemical that has health risks, and so So, there are places in governments you can go to where you could say they're not paying attention, but I would say that my experience with the county is that it has a lot of really great staff and they do pay attention. Uh, it could be that there's risks that need to be addressed that aren't being addressed today, but at least I believe that they are trying to do their job in a responsible way and they are diligent. I did put my email in the chat so everyone has it.
I'm very glad to hear that. And we've had some meetings specifically about the Franconia Government Center where the health department sent some representatives as well as Virginia DEQ. And what we learned from that was that Virginia DEQ doesn't have a way of monitoring air quality per se. They were telling me that if, for example, there was like a train accident, like similar to the one in Ohio or something, where there were chemicals that went into the air, then after such an event, they would be measuring air quality for that. But otherwise, it's not like there's any particular guidance out there that they have people complying with. There's obviously the soil issue. And I've said all along, like, I don't care at all about the soil. Soil can be, totally cleaned up. That's not an issue. That can be mitigated. I don't know, and maybe there's something out there that I don't know about, but I don't know how you mitigate the air from 5 gas stations. And so with the health department, I've actually tried to reach out to you guys several times, Anna, not you specifically, but because I've tried to get someone to say, have you looked at this? And is this okay? Can we build here? Because so far the health department appears to point to a 2015 cancer cluster study done by the state. And it didn't study benzene, it didn't study radon. It said that there were a variety of cancers and therefore it wasn't a cancer cluster because otherwise they would all be the same. And I don't know, from what I've read about benzene, it can actually cause different cancers. But either way, there's, studies that are more recent than 2015. And I'm sorry, I've not been able to get the health department to come out and say, which is what I would like. I would like the health department to come out and say, it is okay to build here. Like we believe this is acceptable to build. And I don't think that's that unreasonable because the county is poised, just so you know, to start approving these. The Springfield one, like I said, went to the Planning Commission. I know it was deferred until some point in November, but there's decisions that are being made right now that will affect people's health. And so I guess I'm sort of at a loss as to where to go here, but I wanted to, sit and listen and see what I could learn. So yeah, that's it.
I think we've hit our time hack, haven't we?
Yes,
Yeah.
it is. It is.
I just wanted to say one other thing. I want to echo what Larry said about those categories that you had. I think they look pretty good too. And particularly the idea of looking for like a total community access to things like, good food or hospitals or some of the other things that were there, I think is a much better holistic look at how we put density into areas and develop areas and make sure that people have access to all the things they need.
Thank you. Thank you for joining tonight, everybody.
Hey, Anna, could I get your email
comments.
address? Oh, sorry. Anna, could I get your email address?
Sure, I'll put it in the chat.
Great, thank you.
All right.
And with that,
Thanks,
I think that
everybody.
concludes. Yes. Thank you, everyone.